Okay, today we're going to talk about how to use the epinephrine for anaphylaxis kits that we are sending out to replace the EpiPens that we carry out for giving immunizations to patients. Once again, just to remind you, the only time we're going to use epinephrine for a patient is when we are having some generalized symptoms of an anaphylactic reaction to a vaccine. And those types of symptoms are swelling of the lips, face, mouth, or throat, difficulty swallowing, fainting, a large drop in blood pressure, lightheadedness, flushing, sweating, irregular heartbeat, difficulty breathing, bronchospasm, and tightness in the chest or shock. So those are the only cases where we're going to be actually using the epinephrine. For patients who have some redness with or without hives or itching around the injection site, in those cases, we're not going to give them epinephrine. We're going to keep a close eye on them for 15 to 30 minutes and just make sure that they don't have a generalized systemic response. For someone who just has hives after a vaccination, if there's no anaphylactic reaction, they can probably take some Benadryl and help to relieve the hives, or another medication, another antihistamine would be fine. But this is, again, only to be used for patients who are having a severe generalized anaphylactic response. So once we've determined that the patient is having that, the first thing you would want to do is open up your kit. There's a white cap on either end. You can open either end. Just pull the cap out. Inside the kit, you'll find two syringes, 1 milliliter syringes. You'll find two of these filter needles, and also one vial of epinephrine, glass vial of epinephrine inside of a foam case. And to open the vial, for those of you, if you can't remember, it hasn't been a while since you used the glass ampule. Normally when you pick up a glass ampule, there's almost always going to be some fluid here in this tip. So what you want to do is just flick that tip a couple times until there's no more fluid remaining. At that point, you can open it up safely with all the liquid in the bottom. If you do forget to do that, and when you open it, you notice that there's only half the liquid in there, the liquid will generally stay in that tip, so you'll still be able to withdraw it. It's just going to be more difficult because you're going to have to go grab the smaller piece, and getting the needle into the smaller end is a little more challenging than using the larger part of the ampule. So at this point, you can open the ampule. You'll see, hopefully this shows up on the video, but you'll see there's kind of a scored line right at the neck of the ampule. And that's where the ampule is going to break. You want to make sure that you use a piece of gauze or something else to protect your fingers. You could even use the foam padding if you don't have anything else. So wrap that around the neck of the ampule, and then turning it away from yourself, just twist the top of the ampule, apply some pressure, and it will break off. And you'll see there the ends are fairly sharp, so you want to be careful with this. This empty piece of glass you can dispose of in the sharps container. Now you can go ahead and set this down, take your syringe, attach the filter needle, and these filter needles just, that small cap twists off, and that's the lower lock tip. You can pull that out, and now you can use this to draw up the dose that you want. You'll see on the package, the anaphylaxis dosing is printed here. I don't know how well. There we go. That's a little better. You'll see that ideally you want to use patient's body weight if we have it, and we have printed on here a chart that basically goes by body weight and then also age if we don't have the body weight. For anybody over 100 pounds, they're going to get a half a milligram, which is half a milliliter of the epinephrine. For the less body weights here, you'll see there's a bunch of different classes. It goes all the way down to 0.05 for infants 1 to 6 months old who are probably not going to be doing too many vaccinations on. But again, just refer to the chart and determine which dose you need to use there, using body weight first if you have it. So for this patient, let's say we're going to draw up half a milligram or half a mil. The good thing about epinephrine is it doesn't really matter if you get milligrams and mils confused because they're the same. Just stick your needle into the ampule and withdraw the amount you need. And at this point, you can recap the filter needle, because we don't want to use the filter needle for injection into a patient. They're 18 gauge needles. They're fairly large, and it would probably hurt quite a bit, and there'd definitely be some bleeding for an IM injection. You want to use the same type of needle that you are using to give the vaccination, so a 25 gauge, 22 to 25 gauge needle is preferable for most folks. And then you can attach your 25 gauge needle here. Again, make sure that you have the correct dose. So you see here we're a little off 0.5, and now you're good to go. After you're done administering the epinephrine, definitely recap your needle, and then dispose of this in the sharps container. At this point, again, for patients who have an anaphylactic response after you give that first dose of epinephrine, you want to make sure that you go call 911 right away, or whatever the emergency system is in the facility that you're at. If it's an assisted living facility, perhaps that's contacting their director of nursing, their front desk, and letting them know there's an emergency that requires an ambulance, and then stay with the patient until EMS arrives so that they can transport them for further management and observation. If you have any questions about how to use the ampules or the epinephrine kits, please feel free to let me know. Again, you can email me at rkarecki@recoverhealth.org, or you can give me a call in the office at 952-908-6091. Thanks a lot, and I hope you guys hope you're able to use the epinephrine kits without any issues, and hopefully we'll never have to use one of these, but it's always good to have them just in case.